Hello everyone. Thank you for joining our poster presentation today. We will be presenting our research titled SLP's Perceptions of Rapport with Clients' Spanish-Speaking Family Members. We will go into detail about each section. First, we will begin with some background information. The research question addressed in our study is, what is the speech-language pathologist's perception of their rapport with their clients' Spanish-speaking family members? First, we will discuss background information and available research in this area. The total Hispanic population in the United States is 18.5%, and as we know, this number will continue to increase in the upcoming years. In New Jersey, 200 SLPs identify as Spanish service providers. That makes up only 3.1% of the total SLPs in New Jersey. This information indicates that many monolingual English-speaking SLPs are serving clients with Spanish-speaking families in New Jersey. The relationship between a clinician and the client's family may be as important as their relationship with the client. This relationship may be less than optimal when the SLP does not speak the language spoken by the family. Much of the literature does not focus on clients with Spanish-speaking families. While there is some research that has been conducted in the area of SLP confidence when serving bilingual families, the clinician, family, and parent relationship is only lightly touched upon, creating a gap in knowledge. Now we will discuss the methods section of our research poster. The participants included were 41 New Jersey SLPs. A survey was developed and sent to the SLPs. When developing questions to include in the survey, some of the topics that were kept in mind included rapport, communication, relationships, and the use of interpreters. Questions that were included in the survey were asking about demographics, the SLP's own perceptions towards what rapport is, how SLPs communicate with Spanish-speaking family members, and how they view their relationships with Spanish-speaking family members. To ensure validity of the survey, it was sent to 4 SLPs, 2 of whom were bilingual Spanish speakers. Comments made by the SLPs were taken into consideration to verify the format and content of the survey questions. The final survey included 19 questions. The survey was created using the online software Qualtrics. To collect our data, the survey was sent to SLPs in the state of New Jersey through NJSHA. Both qualitative and quantitative data were collected. Qualitative data was analyzed using thematic analysis, and quantitative data was collected using descriptive statistics, and inferential statistics were created using SPSS, Spearman's correlation, and Wilcoxon signed rank test. We will go into more detail about the quantitative data and the inferential statistics that were collected in a few sections. Now we will discuss the findings of our study. We have broken up our findings into 4 categories. We have participant characteristics, communication and interactions, rapport, and rapport with Spanish-speaking families. First, we will discuss the participant characteristics. A majority of our participants indicated that they do not speak Spanish and have been working as an SLP for over 21 years. Most of our respondents also worked within the school setting. In terms of communication, participants indicated that they use their own Spanish skills when communicating with Spanish-speaking family members. Most also reported that they typically spend about 30 minutes or more a week communicating with clients' families. In terms of rapport, when asked to describe what rapport is in their own view, the most common themes in the responses included relationship, communication, and perspective. The majority of respondents also strongly agreed that rapport with a client's family is important for the success of therapy, and they also feel confident in their ability to maintain rapport with families. Participants' relationship with Spanish-speaking family members was described as good, similar to that with English-speaking family members, or poor. When asked about how developing rapport with Spanish-speaking families was facilitated, common themes in the participant responses included that it was facilitated by communication about therapy goals and activities, clinician experience, the use of translators or interpreters, understanding and respect, and also nothing. When asked about what barriers they felt impacted their rapport with Spanish-speaking family members, some common themes in the responses included the language, low attendance or work schedules, aspects of their culture, family, or environment, limited education or understanding of special education, and a lack of trust. A majority of respondents perceived their relationship with Spanish-speaking family members to be similar or weaker when compared to English-speaking family members. When asked the parallel question about their relationship with Spanish-speaking clients, 46% of respondents reported a similar relationship, while 41% reported a weaker relationship. Spanish-speaking family members were perceived to have a similar or weaker understanding of therapy goals and a similar or weaker understanding of therapy activities when compared to English-speaking family members. In summary, these findings present that SLPs believe they have a similar relationship with their monolingual and Spanish-speaking family members. We can also see that there is a difference in responses when asked about Spanish-speaking family members' understanding of therapy goals versus the understanding of therapy activities. We will discuss this in our next section where we talk about the inferential analysis, and we will also discuss it in our discussion section at the end. We will now discuss the inferential analysis of our findings. To determine if there were correlations, we used Spearman's correlation and Wilcoxon's signed rank test. There were weak non-significant correlations between how much experience clinicians had and how they viewed their relationship with Spanish-speaking clients, Spanish-speaking family members, and how they perceive Spanish-speaking family members' understanding of therapy goals. Spanish-speaking family members understood the activities of therapy better than the goals of therapy. Now we will go into detail about the discussion section of our poster. The results of this study show that SLPs believe that they have a similar or weaker relationship with Spanish-speaking family members when compared to monolingual English-speaking family members. This weaker relationship may be due to the barriers in developing rapport with the Spanish-speaking family members. Two of the most common barriers that were reported by the SLPs included the language barrier and low responsiveness and attendance and work schedules of the family members. Results also show that the SLPs perceive Spanish-speaking family members' understanding of therapy activities to be better than the understanding of therapy goals. This may be due to the more complex nature of the therapy goals and difficulty in accurately translating and explaining them. More than half of the respondents had been working in the field for over 21 years. It's possible that with more experience comes a better understanding of developing rapport with family members who do not speak English. Based on the results of this study, SLPs should place extra attention on making sure family members are understanding not only the activities, but also the goals of therapy. Although a large number of SLPs in New Jersey do not speak Spanish, making sure to use a reliable and trained interpreter and translator and to show understanding and respect for the family's culture can help strengthen their relationship with the Spanish-speaking family members. Future research in this area should focus on a larger and more representative sample and should include the perspectives of the Spanish-speaking family members. There are some limitations to our study. The sample was a convenient sample and not representative of all SLPs. Respondents also may have included a large amount of SLPs who have an interest in this topic. The sample size was small and limited only to SLPs in New Jersey. The small sample size could be a reason for the lack of significance of the correlational analysis. Responses may have been influenced by the clinician's experience and place of employment. Thank you for joining us to discuss our research poster. We hope you enjoyed it. Thank you.